Hello friends, once again welcome to my channel Nursing Medicos. Important points: maternity and newborn nursing. Before that, you subscribe my YouTube channel and ring the bell icon so that you can get my all videos notification. In that first one is autonomous sign, an audible click or palpable jerk that occur with thigh abduction. This is confirmed congenital hip dislocation in a neonate. The next one we will discuss, very important point. The specific gravity of a neonate urine is 1.003 to 1.030. A lower gravity suggests overhydration and higher suggests dehydration. This is the specific gravity. Next one is neonatal jaundice in the first 24 hours after birth is known as pathological jaundice and is the sign of erythroblastosis fetalis. Next point we'll discuss, the initial weight loss for a healthy neonate is 5% to 10% of birth weight. This is weight loss. Next one is erythromycin is given at the birth to prevent ophthalmia neonatorum. Next one, Harlequin sign is present when a neonate who is lying on his side appears red on the dependent side and pale on the upper side. That is called Harlequin sign. Next point we will discuss, a habitual aborter is a woman who had 3 or more spontaneous abortion. Next one, cow milk should not be given to infant younger than S1 because it has a low linoleic acid content and its protein is difficult for infant to digest. Next point, breastfeeding mother should increase their fluid intake to 2500 to 3000 ml daily. Next point we will discuss, a mother should allow her infant to breastfeed until the infant is satisfied. The time may vary from 5 to 20 minutes. Means 5 to 20 minutes mother should be minimum feed. Next one, a mother who has a positive human immunodeficiency virus test results should not breastfeed her infant. Next one, after delivery the first nursing action is neonatal airway established. This is first assessment. Next one, administering. High level of oxygen to a premature neonate can cause blindness and as a result of retrolental. Next one is an APGAR score 7 to 10 indicate immediate distress, 4 to 6 indicate moderate, 0 to 3 indicate severe distress. Next one, vitamin K is administered to a neonate to prevent hemorrhagic disorder because a neonate intestine can't synthesize vitamin K. Because neonate can't synthesize the vitamin K. Next one is fetal alcohol syndrome present in the first 24 hours after birth and produce lethargy, seizure, poor sucking reflex, abdomen distension and respiratory difficulty. This is in fetal alcoholic syndrome in first 24 hours symptoms. Next, in a neonate, the symptoms of urine withdrawal may be being severe hours to 4 days after the birth. Next one is in a neonate, the symptom of methadone withdrawal may being 7 days to several weeks after the birth. Next, the nurse should count a neonate respiration for a 1 full minute. Next point, thorazine is used to treat neonates who are addicted to narcotics. Next, the nurse should provide a dark, quiet environment for a neonate who is experiencing narcotic withdrawal. The percentage of water in a neonate body is about 78% to 80%. This is the percentage of the first immunization for a neonate is the hepatitis B vaccine, which is administered in the nursery. Next one, in a neonate, long bitter fingernail are the signs of post maturity. This is sign of post maturity. Next, neonate typically need to consume 50 to 55 calories per pound for body weight daily. Next one, a neonate whose mother has diabetes should be assessed for hyperinsulinemia. Milia may be occur a pinpoint spot or a neonate nose. Means pinpoint. Next one is hepatitis B immunoglobulin is usually given within 12 hours of the birth. Next, in the neonate, temperature normally ranges from 98 degree to 99 Fahrenheit. Apical pulse rate average 120-160 beats per minute, and respiration are 40 to 60 breaths per minute. This is normal. To avoid contact with blood and other body fluid, the nurse should wear gloves when handling the neonate until after the first bath is given. Next point, we will discuss meconium is the first material that collect the urine. Meconium is the first material that collect in the fetus intestine and form the neonate's first feces, which are black and terry in color. Next one is Kegel exercise require contraction and relaxation of the perineal muscles. These exercises help strengthen pelvic muscles and improve urine control in postpartum patient. This is Kegel exercise required for contraction and relaxation of perineal muscles. The next one is after birth, the neonate's umbilical cord is tied 1:2.5 cm from the abdominal wall with a cotton cord, plastic clamp and rubber band. Next point is cutis marmorata is mottling or purple discoloration of the skin. It is transient vasomotor response that occurs primarily in the arm, legs of the infant who are exposed to cold. Next one is neonate who are delivered by cesarean section birth have a higher incidence of respiratory distress syndrome in case of CS. Next point is during fetal heart rate monitoring, variable discoloration indicate compression and prolapse of the umbilical cord. Next point is the best technique for assess jaundice in a neonate is to blanch the tip of the nose or the area just above the umbilicus. This is best technique to assess the jaundice in neonate. The next point is in the neonate the normal blood glucose level is 45 to 90 mg per dl. This is normal range. Next point, tocolytic agent used to treat preterm labor include terbutaline, etodrine and magnesium sulfate. Those are tocolytic agent to treat preterm labor. Next point is in the neonates a strength spine is normal. A tuft of hair over the spine is an abnormal finding. This is abnormal finding in a neonate. Next point we'll discuss, that is acrocyanosis is normal in neonates because of their immature peripheral circular system. Acrocyanosis, blueness and coolness of the arm and legs, that is called acrocyanosis. Next point is the nurse should place the neonate in 30-degree Tyndall back position to facilitate mucus drainage. Nurse should place in 30. The next point is, if a patient missing two menstrual periods while taking an oral contraceptive, she should discontinue the contraceptive and take a pregnancy test. After two. Next point is eclampsia is the occurrence of the seizures that are not caused by a cerebral disorder in a patient who has pregnancy-induced hypertension. Next point we will discuss, after administering a magnesium sulfate to a pregnant patient for hypertension or preterm labor, the nurse should monitor the respiratory rate and deep tender reflex. In case of magnesium sulfate to a pregnant patient. Next point is, treatment of adoptio placenta is usually immediate cesarean delivery. We have to go for CS. The next point is, a 16-year-old girl who is pregnant is at risk for having a low birth weight neonate. Next, threatened abortion occurs when bleeding is present without cervical dilation, that is called threatened abortion. Next, direct antiglobulin test is used to detect maternal antibodies attached to red blood cells in the neonate. Next is, with early maternal age, cephalic disproportion commonly occur. Don't forget to subscribe my YouTube channel. Click the subscribe button to see my next videos. Thanks for watching.